This is the result of a SIBO breath test, small intestinal bacterial overgrowth. And in this case, we're looking at a positive test. Was collected in February of 2025, and it's positive for both methane and hydrogen gases, meaning that there are bacterial species inside the intestine which are taking the substrate that was given, either a lactulose or a glucose substrate, and they are fermenting, making gas out of that substrate, and then that gas is being collected in a breath test after it goes through the body and gets to the lungs. Now, is this the first breath test that this patient has done? No, it's about the 10th. They were diagnosed with their symptoms in 2015, and now we're in 2025, and we've still got a positive SIBO breath test. Now, this is after doing herbal antimicrobials, prescription antibiotics, and many, many different diet changes, low FODMAP diet, SIBO diets, elemental diet, carnivore diet, restrictive diets. So we've got all of the things that she's tried to get rid of this problem, and yet her symptoms persist for 10 years. Now what we're looking at is this same patient's SIBO, small intestinal bacterial overgrowth, results after completing the 8-week protocol of the GI1 powder. This is a very simple, natural treatment that I developed almost 25 years ago to treat these SIBO symptoms: gasiness, bloating, diarrhea, constipation, all of the stuff that can fall under the heading of either SIBO or IBS. And so this patient saw me after the first breath test that you saw earlier in February. We did the titration, we did the treatment with the GI1 powder, and then she repeated the breath test, and it's normal. It's normal for the first time in 10 years of treatment, and I can tell you by experience that this is a permanent resolution. This will not come back. She's done with treating this problem.